Historically, nursing has its roots in holistic care, with nurses defining their role primarily in spiritual terms. Florence Nightingale, one of the most influential historic nurse figures, was a strong advocate for spiritual care. However, with the arrival of the scientific and technological era, the focus on holistic care, including spiritual care, began to wane. In recent years, however, there has been a resurgence of interest in holism and spirituality within nursing, as evidenced by the proliferation of articles and books on the subject in the nursing literature. There is ample rationale for including spiritual care in nursing. If you look at various definitions of nursing, it can be seen that they are focused on holistic care. The role of the nurse is to help clients achieve their maximum health potential, health being broadly defined. Many nurse theorists include the spiritual dimension in their nursing models, for example, Betty Newman and Jean Watson. A number of studies indicate that clients perceive that they have spiritual needs which are important to them, especially in terms of health crises. The research also shows that there is a definite connection between a person's spiritual well-being, their comfort level, and their response to illness. It follows then that if spiritual needs are not attended to, this lapse will likely have implications for the level of health achieved by the client. If nurses are to fulfill their mandate, then spiritual care should be one of their responsibilities. This fact is recognized by codes of ethics for nurses. For example, the ICN Code of Ethics states that the nurse promotes an environment in which the human rights, values, customs, and spiritual beliefs of the individual, family, and community are respected. So you can see that in many ways, nurses are ideally suited to be involved in spiritual care. And this is becoming easier to do in the social climate of today, where there is a general trend to be open to exploring issues around spirituality. In this video program, we will look at the place of spirituality and spiritual care in nursing practice through the eyes of Robin, a nurse who has worked primarily in acute care settings in her nursing practice.
Nurses are suited to be involved in spiritual care because they are faced with the vulnerability of humanity every day. And it's in times of vulnerability that people really reach out for spiritual care, spiritual help. They may not say it directly, I need spiritual help, but when people are in crisis, when people are faced with challenges, physical challenges, health challenges, they're looking outside of themselves and within themselves for the strength to carry on. And you can tell, you know, when you're speaking with them, that they are almost inviting you in sometimes by what they say. Some people don't, and you totally respect that because that's what they are. Nurses provide care for what is needed, and you get to see the need because you're with them all the time. I just think that whether people prescribe to a certain faith or not, spirituality is universal. And it is the source of why people act and think. And sometimes in order to get at the root of certain behaviors, certain actions, is to address those underlying spiritual needs. Yes, the person may be sick and everything like that, but if they're actually just very confused about why is this happening to me and things of that nature, if you don't actually address the root problem, the behavior and the question will continue.
If nurses are critical in terms of attending to the spiritual dimension of health in clients, how can they begin to tackle such a task? Well, nurses need to be aware of how their clients define spirituality. And they must respect clients whose view of spirituality may be different from their own view. This will enable them to be better able to assist clients in meeting their spiritual needs. But first of all, nurses need to begin with themselves, to clarify their own spiritual positioning, and to be aware of their own spiritual needs and their own spiritual quest. This is important, as the literature shows that nurses who have a strong sense of their own spirituality are better able to provide spiritual care.
I think the biggest piece in preparing yourself to providing spiritual care is to attend to your own spiritual needs. Taking time for yourself, quiet time, thinking about what you want in life, understanding yourself why you're feeling stressed and attending to that are the first steps in learning about spiritual care, because you're attending to your inner life. And when you attend to your inner life, then you recognize that other people have inner lives too. It was just something that was a part of me, and because it was an important part of me, I always looked to see if it was an important part to somebody else. So attending to your own personal needs, to your own spiritual needs, I think is primary.
Nurses also need to develop qualities that are essential to excellence in nursing practice generally, such as being non-judgmental, being truly present with the client, being open to talking about spirituality, that is, taking risks and asking questions that may be personal, having a commitment to give to the client, being curious, being authentic and compassionate, having good interpersonal and communication skills, and so on. When it comes to spirituality, nurses also need to be willing to live with the ambiguity and mystery that often surrounds spirituality, not feeling that they have to have all the answers. In order to provide effective spiritual care, a key skill for the nurse to acquire is the ability to be able to assess within the realm of spirituality. All nurses, regardless of their own spiritual positioning, need to develop competence in this skill, and there are various spiritual assessment tools to help them. Nurses can naturally weave assessment questions into conversations with clients. For example, a nurse can ask a client, "Is religion or spirituality important to you?" Or, "What gives your life meaning and purpose?" The nurse can also engage in conversations about spirituality based on unprompted cues provided by the client.
Some cues that patients may give you that they need spiritual care are open-ended statements that are very hard to answer. Like, "So what does this all mean?" Or, I never thought this would happen. However, there are more times than not that I just ask them,